All right, this is Dr. Philly. We're doing a third trimester scan to follow up growth in this fetus. And starting off, we'll buzz through these images. We can see that the placenta has become a little bit calcified. I don't usually grade placentas, but this is probably grade 2, maybe getting towards a 3. AFI looks okay. AFI looks like it's measured properly here. Notice putting color on it to make sure you're not measuring pockets with cord that's tricking you. And in the left lower quadrant here, all we see is some vascular flow. So she doesn't have a non-color picture here, but if you had a non-color picture, this piece of vessel here might actually look like fluid that you may be tempted to measure. In this case, the amniotic fluid is normal, so it doesn't really matter, but it certainly can matter at certain times. Nice BPD and head circumference measurements here. Perfect alignment. Really nice 3-vessel view. You can see the ductus arch, the ascending aorta, and the superior vena cava. And you can also see the pulmonary artery branching right here. So this is a great 3-vessel view. And we're measuring the cervical length, which looks fine. And there's this large vascular structure that's down adjacent to the placenta. And a previous examination, that was not there. If we do a cine clip, you can kind of see it wiggling through there. So what is that thing? We're doing spectral tracings. It looks mostly venous, so it could be a large vein at the edge of the placenta, a marginal vein or a marginal sinus. That's a possibility. It wasn't there before, though, which is kind of unusual. I'd like to see some arterial flow, but if you look at that cine clip, the way it sort of wiggles through there, I wouldn't say this is the best cine clip. It may just be the cord which is coming down, and it's in a presenting location. So we call that a presenting cord if it is in fact the cord. So we'd want to at least follow this up later in pregnancy. And then growth-wise looks okay.